Friends, this is a bit unusual. This may actually be the first in nearly a decade of doing podcasts that I'm interviewing someone who works in architecture. Abbie Clary, who's our guest today, is a fellow of the American Institute of Architects and the American College of Healthcare Architects. And we're going to talk about her current role, but prior to that, she spent over 7 years as the principal director of the health practice at the prestigious CannonDesign firm. She and her teams built tens of millions of square feet of space for world-renowned healthcare systems like Kaiser Permanente, Memorial Sloan Kettering, and the University of Chicago. The list goes on and on and on. Her leadership has earned her widespread recognition, including in Modern Healthcare, in Healthcare Design magazine, and by Cranes. And then, about a year ago, in April of 2025, she was promoted to be the executive director of market strategies and growth for something called Health for All. And here's how this was described in the announcement a year ago. It said on the website, in this expansive role, Abbie will drive market strategy growth and visibility for CannonDesign across the full spectrum of health, from hospitals and clinics to public health, academic medicine, wellness, mental health, neurodiversity, survivorship, healthy communities, and more. This is quite amazing. I have to say, I'm really curious. And then actually, Abbie, you were quoted in that same announcement, and here's what you said. I love this. You said, health is so much more than healthcare. Health is so much more than healthcare. And this role embraces that reality. CannonDesign knows that every ounce of our built environment, from where we live, work, learn, heal, and socialize, impacts our health. And you go on to say, I'm grateful for this opportunity to push towards exciting health paradigms, to not just design buildings that support healthcare, but to use design as a tool to advocate for health in all its forms everywhere. Oh my God, I'm reading this and I'm just getting chills, Abbie. The vision that CannonDesign had in creating this new division, putting you at the helm. I know that there are a couple of other sister divisions that were created at the same time that focused on complementary parts of our environment. Two major questions. What is this that you're doing? And even before that, you've spent the first year, I know, because that's how we met in part, doing a learning tour, going around the country, talking to healthcare folks, health folks. I am so curious as to what you've learned over the past year. What ideas have you formed? What ideas have been changed or deepened? If you could just give us a journey of your learning over the past year, coming especially from this place of thinking about space and design and buildings and how the environment shapes who we are and how we behave. I'm so excited to listen to you. So I'm just going to shut up right now.
Well, thanks for having me. Wow, there's so much behind what you just asked me. So please interject as I go, because I'd love to have this as a conversation. But so when we envisioned this role, first I'll start out by saying I truly believe that designers and people that are trained in the design world, architects, interior designers, industrial designers, we are trained to have the ability to take many disparate parts and complex situations and be able to put those things together into a simplistic response. And that creative intelligence and that creative skill set, I strongly believe, belongs in the built environment, but also beyond the built environment. And part of the beginning of the Health for All for me is that I want the world to know that someone like me should be at the table early, right? Even as early as policymaking, because that creative intelligence and that skill set that someone like me brings to the table early actually brings a point of view that could be very useful. And then that point of view at being at the table early helps to design, the continuum from policy to place. They're totally interconnected. People don't always think about them that way, but does creative intelligence at the front and then taking that to actual design, built environment at the end, that continuum, we can get better outcomes down here. The other thing I would say is along those lines is that I think that design can actually be a determinant of health versus an end result vendor, kind of reaction. Because the built environments, as you know, affect outcomes. How we design, pedagogy for training physicians and nurses, how we design buildings and how people arrive in that. Are they culturally aligned with the community that they're serving? So all of these things, like it's really important, right? And starting early will make sure that that's also engaged early, if that makes sense.
And the fascinating thing about, I have studied design in the past. The fascinating thing is there's actually a process. It's not like sort of like sitting there with a white piece of paper. There's actually a process of understanding, whether it's sort of ethnographic research. I mean, there's all kinds of tools and techniques that can help you figure out what are the right questions to be asking, and then figuring out the answers to those questions so that you're not at the end, you've built something that really doesn't serve the purpose or isn't as optimal or as effective as it could be.
Yep, that's right. There's a whole process of actually collecting both qualitative and quantitative data. And a lot of people, they gather qualitative data through like focus groups, but the qualitative data has to really be looking at behavior, culture, community, all of the things that are more emotional and how we engage in our health, so that we're not only developing an efficient process within the health environment, but it also is removing some of those latent needs or workarounds that people don't even know they have. And you can't get to that without doing that sort of ethnographic look. And the worst thing that could happen, I mean, very traditional architects, the way we were taught was like being the master builder, right? And I know what you need kind of thing. And I'm going to design something beautiful. And you end up behaving in that space the way I think you should, right? That's not the way, at least that's not the way healthcare design should work. It should be about the patients and the staff that are in that space. And we go upstream and design operations and strategies and workflows. Like that's all part of it, just enabling technology. Creating that is not just a built environment thing, I guess is what I'm saying.
Yeah.
And so then the health for all lens, where that came from is, so we recognize that with all those skill sets, there's so many more problems that we could be solving. Traditional architecture firms typically have verticals, like a vertical for healthcare, a vertical for education, a vertical for civic. And we wanted to bust those barriers and create convergence across. And so health for all really could be in everything. But the place that I've taken it to at this point is that I strongly believe that we can design. Okay, I'll start from the beginning. Health system is broken. We all know that. Many times we're like, oh, maybe we do this and we can fix the health system. Well, that's not going to happen. The health system is it's building on itself. It's just this perpetual loop that is the momentum. Unless we change insurance and change the incentives of insurance, nothing's going to happen, right? So thinking about it that way, and also thinking about the world we live in today, which is it's like we have to ride the wave of chaos, right? We can't go strategy building how we used to do it isn't going to do it anymore. So in my head, then I said, okay, so what does that mean for health for all? And to me, that meant we have to sit outside the system and find ways to design the conditions for the opportunity for health instead of the response to sickness. And so that means, and then it's the downstream, right? So if we can be the determinant of health, where we're identifying a gap, we can design with partners. I mean, we won't be able to do it all by ourselves. This is a serious, like we have people in-house, but I've got to build a huge network of partners who could help do this. But if we can design the conditions which people have the choice to be healthy, we can then design the environments that support that condition. And so things that I'm focusing on, I have a few things that I'm personally focusing on. Oh, and I did make 3 claims. Let me share these 3 claims with you that are sort of my foundational claims. The first one is that healthcare was designed around the wrong assumption that treating illness is the same as producing health. Not true. So we want to focus on how do we produce health. The second one is design is a determinant of health when it is a continuous practice from policy to place. It can't be a determinant of health if it's at the end reacting to a strategy someone else created.
Yeah. Oh,
and then the
that.
last one is that the firms that will shape the next era of healthcare are building new conditions under which health becomes possible for everyone. So those are like my big three claims. And then I'd say my vision statement is we will design the conditions under which health and human experience becomes possible and the environments where they become real.
Oh, I love that's like a manifesto.
Yeah, maybe like make a layer of what must be and always apply that to every single thing we design, whether it's a community, whether it's an urban plan, whether it's a building, whether it's a workflow or a process. Like, how are we doing that to promote health, wellness, but also to give the opportunity for health? Because that's access, right? If we can give people the opportunity to be healthy, I can't make them, but if I can make a better opportunity for them to make that choice.
Abbie, give me an example of what do you mean by I love this and I have some thoughts, but what does an opportunity for health mean to you? Like, what would that look like? I love that phrase, by the way, opportunity for health. That's really very cool.
Yeah, it could be working with a city planning department to do an analysis of the city plan, literally, and start to identify areas of opportunity. To your point, to put in green space, to put in the trees that eat toxins out of the air. It could. I think that's a big one. It could be looking at working with departments of education and talking about what are the things that we can do in school. Like there's research that says the quality of the air in the school directly affects the ability to learn.
I'm sure.
So that seems like an easy thing to take a look at. So what are all the conditions that aren't currently even being thought about that if we tweaked them would give a better opportunity for health and wellness? And when I say health, I don't mean just physical. I mean social wellness as well, right? So it's physical, mental, social. It's not just, the science part of being well.
What is something you've learned over the past year that either surprised you or was not in line with what you thought before? Was there something new that struck you about healthcare which you didn't? And I think, even that notion you talked about, that healthcare does not equal health. Health is a much bigger and quite different endeavor in many ways. But I'm just kind of curious if there was something about that and I know you've been talking to folks, lots and lots of experts in different fields, something, and maybe even a story or some design or some project or something that was like, wow, I didn't know that. That's really helpful in terms of guiding me.
Yeah, I guess I would answer that around women's health in general. So I'll tell you a story, and then I'll tell you some other things that I've learned that now has me on sort of like a mission to make women's health better. So the first thing is me. So I about 2 years ago, I think, maybe a little bit more, I can feel my heart skip in my chest, and it scares me because it kind of stops and then starts again, and then I panic, and then it's worse. And so I ended up going to see a cardiologist, and everything's fine. Apparently, I can just feel my heart skip a beat in my chest, but I went to do all the tests to make sure that everything was okay. And so I had to do a echocardiogram. Is that the right word?
A sonogram of the heart.
Yeah. So I had to run on the treadmill and then quickly lay down on my side. And then they did ultrasound to see it as it went into a resting state. Right. So when I showed up, I was ready to go I had my running pants on, my sports bra, and my gown. Right. And the technician says to me, well, you can't wear the sports bra. And I was like, what are you talking about? and I'm hope this doesn't offend all of your listeners, but I'm a double D, and I'm humiliated standing there saying, "You want me to run on a treadmill without a sports bra
Mm.
because the nodes couldn't get where they needed to go, right?"
Right.
And then there was going to be a male tech who was going to do the ultrasound when I lay down on the bed. It was humiliating. I started crying.
Mm.
They
Mm.
understood. They brought in two female techs instead. I
Mm.
mean, they were totally empathetic, really,
Mm.
lovely. Still had to do it the way they wanted. But I walked out of that room saying nothing that just happened was designed for a woman. Like
Wow.
the gown, right? Gown, oversized, straight, flat gown. Obviously, the fact that I couldn't wear a sports bra. Um, Even like the room and the way it was set up. So that was like a moment where I was sort of
Wow.
like energized, like I want to do something about this. So then I went and did a ton of research, and
Mm.
and it's I don't know how much time we would have for me to tell you about this, but what
Yeah.
ended up happening is there's this thing called the default male, and it's been baked into society since Greek, like way back when the Greek physicians were saying that the ovaries are testes on the inside, and that the
Right.
uterus was the sac, and like so they were just making us men but turned inside out. It was kind of born there, and ever since then,
Wow.
male is the main is the
Yeah.
default, and woman is always the outlier,
Wow.
right? So it's always designed for this. And then in like the 60s, the US government created this thing called the reference man, which was a 5'9", 145-pound young white man. And this was the reference for safety and research. So, we always hear about how women are not well represented in medical research. Well,
Hmm.
this is where that started. And from there, that concept then turned into what people used as the model for everything. So think rungs on a ladder, pianos, male hand width, even the iPhone. Like I can't text with one hand. My husband can. Like everything has been then modeled on male proportion. 72 degrees is based on a man's metabolic rate.
Wow.
So now this is just all in, right? And we all
Right.
live within it. It's just part of our
Wow.
societal construct.
Right.
And so that's the biggest thing I learned. And so then I think, well, what's the condition
Wow.
that I can design differently
Right.
for women's health, right?
Yeah.
And I mean, even yesterday, I was writing an article about how even the information and data that we are putting into these AI large learning
Yes. Yes.
models
Yes.
is that information, right?
Well,
Like
no, I've read that too, that it's mostly young men that are putting all this information into
that too,
this.
that too. And the data is our past data, right? The data I
Right.
just described that doesn't
Oh,
have us
interesting.
represented is being put
Right.
into the AI. And AI isn't seeing bias, right? AI is seeing a pattern. And so there was this
Wow.
study in London last year where they took a LLM, and they took two, like the same issues, same whatever the clinical issues were with the patient, and they put in all the same data into AI. And they first like said it was a man, and then they second said it was a woman. And for the man, they said he had some sort of critical conditions and needed care. For the woman, they said that she lived in a townhome and was independent. Like couldn't have been more different. So the woman is not
Hmm.
being flagged to receive the care, but the man was flagged to receive the care.
Wow.
So they really identified I mean, there's a huge data gap that still exists. And so what do we do about that? So what can we design? Because we can't
Hmm.
currently I can't fix that.
Right.
So what can I do? Right? What is the condition I can design outside of that? I don't have an answer yet, but that's one of my focuses this year is women's health.
You talked about your health for all. Where, what would you like to, what have we missed, and where are you going with this?
Um, I think where I'm going with this right now, and this would be really important for your viewers to hear, is that I am I'm trying to create a very dynamic, diverse network of people who are doing all sorts of different things in order to create the opportunity for health. Because there's lots of things are happening in pieces, right? There's a
Mhm.
lot of people out there with great intentions doing awesome things, but I don't think they're all connected. And I kind of think of us as like the master knitter, right? Like we have, like I said in the beginning, we have this like natural talent to take just all these parts and put them together into either a solution or the right team to create the solution. So that's the first thing I'm doing this year is really trying to build that network. And it means it's not architects, right? That's not who I'm interested in talking to. So
Right.
that's part one. And then really my next 2 years are going to be focused on, like I said, women's health. But the other one that we missed that we didn't talk about is generational behavior.
Hmm.
And thinking about this is really for us starting more in the pediatrics environment, but
Hmm.
thinking about how would now that Gen Z is going to be the parents, right? Gen
Yeah.
Alpha is our native technology users. Like, what changes in the way that we design healthcare, education, and
Hmm.
health for kids because of the way that they're brought up, right? We can't design pediatric hospitals the way we did 10 years ago. It won't work. There's a whole different expectation from Gen Z, from like, for example, mental and behavioral health, all out there, right? Like there is no stigma. It is very important to them. So what does that mean to how we design a new campus, a new community, a new, K through 12 school?
Hmm.
So that's the other place that I'm very interested in developing a stronger point of view, and then identifying how design might help take those findings and make something better.
I so first of all, I'm writing down. I have a whole bunch. I have a bunch of people I'd like to. You may know them already. You may not, but I'm gonna after this, I'm gonna share my thoughts about who I'd like for you to introduce you to. Um, I would put a plug in, and this is somewhat self-serving. For I love the generational. We know the population is aging, right? I mean, like seriously aging, and we know at this point, I think in by 2032, so in 5 or 6 years, there will be more people over 65 in this country than
Yep.
under 18. And so, I don't think the environment has been built for older folks, and I'm seeing, we see this crisis, for instance, just a very concrete example that most of us witness quite often is at airports. You see how many people now are being wheeled,
Mm-hmm.
to,
And the
and
autonomous ones. Uh-huh.
yes. Oh,
Have
you
you
know what?
seen those?
No, I haven't
Oh
seen
my
the auto.
gosh. Yeah, they're in Seattle for sure because I've seen them there. The only problem with them is they're very slow.
Oh,
I mean, I'm
okay.
sure that's on purpose, but I'm sure the person sitting in the chair is like, can we just go a little faster?
Right. But my point is the airports weren't designed for this,
Mm-mm,
right?
mm-mm.
And you could see just the space limitations, the time issues, the even the people issues in terms of, having it's, and so I think we have to think very, very much about, the over 55, over 60, over 65 crowd, which is becoming a dominant part of our society and their needs as well. So a little bit of plug in for the older folks.
Yeah, well, I agree with you completely. And what I think is cool about both the generational behavior and the women's health is it is really a convergence topic of its own, right?
Yes.
Because behavioral health, all ages, I would love to eventually get to everything. I'm starting
Yeah.
small, but
Yeah.
we should get to where you're talking about. And then on a personal note, my dad had primary progressive aphasia and dementia before he
Mm.
died. And when he had the seizure, I me and my mom, we're navigating this awful system, and there is a serious black hole for people that have memory care and dementia
Oh
issues.
yeah.
Like nobody would take him, and so because there's no forward
Mm.
progress and Medicare won't
Mm.
pay, and like all these
Mm.
things. So I am
Mm.
personally
Mm.
aligned with wanting to figure out how to do that better. And then
Sure.
the last thing that I think is missing with regard to that is access. Like people who have money can get what they need from a living and clinical care and all that. But what about the people who don't? And
Absolutely.
so I think
Absolutely.
there's a lot of need there too, and is absolutely we have that on our plan for the next 3 years to develop
Mm.
what is it that we as CannonDesign can make a difference in. So wholly aligned.
You know, um, I think what Canon Design, what you and your team are doing, your division and Health for All, and what Canon Design is doing is it's really kind of mind blowing. The notion that built uh, built environment, that design and architecture, that these could be sort of core health and healthcare vocations,
Hmm.
disciplines. I mean, who would have
Hmm.
ever thought of that? At least, but they are. And I think for me, that's the major point of this conversation, to get across to folks. And given that this expertise and this ability to design for health, to create, as you call it, opportunities for health with people who actually understand it, with the expertise, and you, like you said, it's really a team, right? That's required
Hmm.
to do this. And I just think that's a real game changer. And I think you're, in some sense, I think you're really a pioneer in an area that is likely going to really grow. And I'm it makes me, there's a lot of things in healthcare that can get you very down and very jaded. And I think this is quite the opposite. I think this is looking at this and saying, but look, we never thought this even, 20, who would have thought this even 10 years ago, that
Hmm.
architecture and design could really be a solution to create health.
So I'll tell you, that's the other thing that I'm trying to undo. Somewhere along the way, someone decided that designers were about buildings,
Mm,
and designers are so much more than that. And so that's another part of the mission of this message, is
mm.
that that's not, like, we can follow through, super important, right? The follow through is as important as like solving of the problem.
Right.
But that's not the only thing we can do, right? And so
Mm,
I want to get the word out to, not like outside of my industry, like
right.
to your people, like your listeners, like to
Yes.
start to understand that design is bigger than buildings.
Oh, I love that. Design is bigger than buildings. Well, you've given me, given us so much food for thought. And again, I'm excited to continue the conversation with you. And if I could help in any way, just let me know.
Yes, well, I'm sure there are lots of ways. Positive. I'm just glad to have the conversation. It's been really fun.
Really, really fun and actually enlightening. So thank you, Abby.
Yeah, you're welcome.